So this is the supplementation video part 2 for long COVID, hypermobility, Ehlers-Danlos syndrome, and dysautonomia. Again, my qualifier, I am not a nutritionist and I am not a doctor. So this is for general educational purposes only. In part 1, I included a list of tests that you might want to take to see if any of these could be issues for you. The first video, I also talked about K2, calcium, and vitamin D levels. With this video, we're going to be talking about a different triad, and that is going to be zinc, iron, and copper. So these all have to be in balance for optimal health. I'm going to be going through why. The most common thing that you can think of if somebody's talking about fatigue is going to be anemia. So iron deficiency anemia, the signs and symptoms are right here: extreme fatigue, weakness, pale skin. We've got that fluttering heart, shortness of breath, cold hands and feet, inflammation or soreness of your tongue, brittle nails or hair loss, and then cravings for ice. So I included the lab levels here that you're looking for, but you might be scoring in the low normal range. Anything under 60 is contributing to fatigue. And again, if you are experiencing fatigue, we would prefer you to be in the high end of normal. So how do you get iron? You can get it through meats. You can also use something like a cast iron skillet or my Lucky Iron Fish. Unfortunately, there is low bioavailability for some of those plant-based iron foods. So just know if you are a vegan, vegetarian, if you don't eat much meat, this may be something that you need to supplement. Talk with your doctor about. Now, you also, if you are taking supplements, you want to make sure that you are taking them correctly. I've got a really long list of do's and don'ts. So you want to actually avoid taking iron or ferritin supplements with beans, seeds, nuts, grains, and legumes, because these basically are stealing the iron and don't allow it to get into your system. So those are called phytates. So if they are soaked, sprouted, or fermented, this helps to get rid of that, which is going to be basically stealing that iron out of your system. You also don't want to take it with calcium. So any foods that are high in calcium, or again, a calcium supplement. You want to avoid taking iron with polyphenols. So that's going to be things like coffee, tea, berries, and apples. And then you also want to avoid taking it with these specific medications. I'm on thyroid meds, and of course I have to wait about 6 hours between taking my med for my thyroid and then taking my iron supplement. So for the do's over here, you want to take iron on an empty stomach or with vitamin C sources. I've got on here that you want to make sure you are not copper deficient, because copper deficiency basically means you are not absorbing iron. And then additionally, if you're just starting iron, you might have a little bit of a reaction just because you've got some oxidative free radicals. So not with your iron, but you also may want to add in at a different time of the day some antioxidant support. Next up in this triad is going to be copper. Okay, so I just told you you need copper in order to absorb iron well, but this is also just saying these three are synergistic. They do work together. So zinc and copper are on a seesaw, and you need to make sure if you are doing a ton of zinc supplementation that you are not then copper deficient. So make sure that these are all kind of staying in balance with each other. I've got up here copper deficiency anemia, which is going to look very similar, but this can actually cause demyelination of your cranial nerves. That's a big deal when we're over here talking about the severe symptoms. So this is really something, getting your copper and zinc levels tested. It can make sure that you are not basically presenting the same way an MS person would with that demyelination. So too much zinc can cause copper deficiencies. Copper deficiency risk, here are some medications that interfere with it. Again, we've got the excess zinc supplementation. We've got some GI issues, nutritional issues, and then also there are some diseases that are associated with copper. Those are usually hereditary. You can also have copper excess. We've got another hereditary disease that's associated with that. So I threw this slide in here just so you know you don't want to overdo it with copper either, because that can cause physical, psychiatric, liver issues. So here are some signs and symptoms of that. Additionally, high copper levels has been associated with cancer. So you do want to double check and make sure again that iron, zinc, selenium, copper, all of those are kind of working well. So please, if you know anybody with cancer, that could be a good piece of information to share with them as well, because it can help. It's correlated basically with cancer progression. So talking with our doctor about zinc supplements could be a good idea. Best sources of copper we have here: shellfish, liver, fatty fish, oysters, spirulina, mushrooms, and dark chocolate. And then we have a summary again of this information, which is basically talking about copper excess versus copper deficiency. It is a great slide. It's got some copper functions on here and copper sources. So the last one in our triad is going to be zinc. So here are some signs of zinc deficiency. Again, we've got fatigue and brain fog on here, which is pretty important. Anybody that's got sickle cell disease or HIV/AIDS are often deficient in zinc. They found that correlation. So if you have any of those, you might want to get that lab tested. I have the goal level, which is about 100 and similar to copper. Causes of zinc deficiency, soil depletion is a big one. So anything that was on that list that as a food supplier of zinc, just know that because of the soil, it might have less of that nutrient. Physiological stress, so long COVID can cause zinc deficiency. Diet, and again, people that are eating lots of those whole grains and beans, because it is high in that, they might have less intake of that iron. In zinc, damage to the GI tract, alcoholism, excessive calcium intake, or vitamin D deficiency. Okay, and then some genetic differences. If you've had your genes tested, I went ahead and listed those out for you below. Sources of zinc. Okay, zinc supplementation. I've got on here the protocol. Again, don't take this blindly. You should be tested to know if you need to supplement with that or not. Don't take zinc at the same time as iron or calcium. Avoid zinc excess as it is associated with fatigue, copper insufficiency, gastric distress, and cancer. However, you do want to make sure that your zinc is not low. The evidence, level of evidence for zinc helping with COVID is high. So here is a summary. We've got iron, avoid taking with, do take it on an empty stomach, and with vitamin C or OJ, helps with fatigue if lab levels are low. The goal for copper is 100 and similar to zinc. Make sure copper and zinc levels are balanced, but it can help with fatigue if lab levels are low. Same thing with zinc. It helps with fatigue and immune system support as long as you are not over supplementing.